The Congressional House, after a tumultuous all-night jockeying back and forth, they passed the, quote, big, beautiful bill. It has been signed by the Majority House Speaker, Mike Johnson, going over to President Trump to sign on the annual 4th of July observance on tomorrow. So what exactly does it mean for you and for me, Tyrone Bowman, live? Welcome to the program, everybody. We're on the road to getting 2,000 subscribers. We need 100 more, and we'll be at our goal for this quarter. So help me make it happen, ladies and gentlemen. As you're coming into the comment section, let me know who you are, where you're coming from, and as always, whether your comments are pro or con, I check them out as I'm going through them. As I'm dealing with the topic I'm talking about, and I'll respond to some of them at the end of the program. According to KFF Health News, the Republican Megabill will mean higher health costs for many Americans. The tax and spending legislation the House voted to send to Donald Trump's desk on Thursday, enacting much of his domestic agenda, cuts federal health spending by about $1 trillion over a decade in ways that will jeopardize the physical and financial health of tens of millions of Americans. The bill passed in both the House and the Senate without a single Democratic vote. It's expected to reverse many of the health coverage gains of the Biden and Obama administrations. Their policies made it easier for millions of people to access health care and reduce the U.S. uninsured rate to record lows, although Republicans say the trade-off was far higher costs borne by taxpayers and increased fraud. That's what they always claim. They're always talking about fraud. They're always talking about waste. In the meantime, they're basically spitting in people's faces and telling you everything is wonderful, everything is good. We're the majority. We have the Senate. We have the Congress. We have the presidency. And there's nothing y'all can do about it. Just sit back, shut up, and take it. Well, midterm elections are coming up next year. And we're going to find out if the American people are buying the big, beautiful bill saga. So this is where we are. It has been the overall arch-reaching goal of the Republicans to dismantle and destroy the Affordable Health Care Act, aka Obamacare. Yet they themselves get health care at a free cost. They have a black card. They can go anywhere they want to. It's not just for them, but it's also for their family members as well. They get huge perks for holding congressional seats and senatorial seats. They also have allowances that everyday people don't have. And they claim that the bill does not eliminate taxes on tips. Let's get into this. The bill passed in both the House and the Senate without a single Democratic vote is expected to reverse many of the health coverage gains of the Biden and Obama administrations. Their policies made it easier for millions of people to access health care and reduce the U.S. uninsured rate to record lows, though Republicans say the trade-off was far higher, a cost borne by taxpayers and increased fraud. Under the legislation Trump expected to sign on Friday, Independence Day, reductions in federal support for Medicaid and Affordable Care Act marketplaces will cause nearly 12 million people, or 12 million more people, to be without insurance by 2034. The Congressional Budget Office estimates that in turn is expected to undermine the finances of hospitals, nursing homes, and community health centers, which will have to absorb more of the cost of treating uninsured people. Some may reduce services and employees or close altogether. And you know what's going to happen? A lot of people are going to stop working in the health care field. They're not going to continue to work with no wage increases. They're not going to continue to take care of the needs of society, and they themselves aren't being paid. And you know how employers are. They want you to work your shift, somebody else's shift, and then somebody else's shift, all for the same pay. That ain't right. You're doing the job of 5 people with the same pay. Some of you may agree, some of you may disagree. That's fine with me. But if you can't pay your personal bills, then you're going to be upset. So the Republicans say, so here are 5 ways the GOP's plan may affect health care. They say, if you need Medicaid, then get a job. That's their attitude. The deepest cuts to health care spending come from a proposed Medicaid work requirement, which is expected to end coverage for millions of enrollees who do not meet employment or reporting standards. In 40 states and Washington, D.C., all of which have expanded Medicaid under the Affordable Care Act, some Medicaid enrollees will have to regularly file paperwork proving that they are working, volunteering, or attending schools at least 80 hours a month, or that they qualify for an exemption. Such as caring for a young child, the new requirement will start as early as January 2027. The bill's requirement doesn't apply to people in the 10 largely GOP-led states that have not expanded Medicaid to non-disabled adults. So basically, the only states that are going to be affected are Democratic states. Republican states will be exempted. Health researchers say the policy will have little impact on employment. Most working-age Medicaid enrollees who don't receive disability benefits already work or are looking for work or are unable to do so because they have a disability, attend school, or care for a family member. According to KFF, a health information nonprofit that includes KFF Health News. State experiments will work requirements have been plagued with administrative issues such as eligible enrollees losing coverage over paperwork problems and budget overruns. Georgia's work requirement, which officially launched in July 2023, has cost more than $90 million, with only $26 million of that spent on health benefits, according to the Georgia Budget and Policy Institute, a nonpartisan research organization. The hidden costs are astronomical, said Chima Dumili, a professor at the Yale School of Public Health. So, less cash means less care in rural communities. Belt tightening that targets states could translate into fewer health services. Medical professionals and even hospitals, especially in rural communities. The GOP's plan curtails a price known as provider taxes that nearly every state has used for decades to increase Medicaid payments to hospitals, nursing homes, and other providers, and to private managed companies. States often use the federal money generated through the taxes to pay the institutions more than Medicaid would otherwise pay. Medicaid generally pays lower fees for care than Medicare. The program for people over 65 and some with disabilities and private insurance. But thanks to provider taxes, some hospitals are paid more under Medicaid than Medicare, according to the Commonwealth Fund, a health research nonprofit. Hospitals and nursing homes say they use these extra Medicaid dollars to expand or add new services and improve care for all patients. Rural hospitals typically operate on thin profit margins and rely on payments from Medicaid taxes to sustain them. Researchers from the Cecil G. Sheps Center for Health Services Research, who examined the original House version of the bill, concluded it would push more than 300 rural hospitals, many of them in Kentucky, Louisiana, California, and Oklahoma, towards service reduction or closure. Republicans in the Senate tackled a $50 billion fund onto the legislation to cushion the blow to rural hospitals. That money will be distributed starting in 2027 and continue for 5 years. So the question is it harder to get and keep the Affordable Health Care Act coverage? For those with Obamacare plans, the new legislation will make it harder to enroll and to retain their coverage. ACA marketplace policyholders will be required to update their income, immigration status, and other information each year, rather than be allowed to automatically re-enroll. Something more than 10 million people did this year. They'll also have less time to enroll. The bill shortens the annual open enrollment period by about a month. People applying for coverage outside that period, for instance, because they lose a job or other insurance or need to add a newborn or spouse to an existing policy, will have to wait for all their documents to be processed before receiving government subsidies to help pay their monthly premiums. Today, they get up to 90 days of premium help during the application process, which can take weeks. Republican lawmakers and some conservative policy think tanks, including the Paragon Health Institute, say the changes are needed to reduce fraudulent enrollment, while opponents say they represent Trump's best effort to undo Obamacare. This thing about fraud is a lie. It's an outright lie. All these people do is lie. Oh my God. They're some pathetic liars. And they lie with a straight face and invoke the name of God in the middle of it. The legislation also does not call for an extension of more generous premium subsidies put in place during the COVID pandemic. If Congress doesn't act, those enhanced subsidies will expire at year's end, resulting in premiums rising by an average of 75% next year, according to KFF. So if you're on Medicaid, do you pay more to see doctors? I think you will. Many Medicaid enrollees can expect to pay more out of pocket for appointments. Trump's legislation requires states that have expanded Medicaid to charge enrollees up to $35 for some services if their incomes are between the federal poverty level this year, $15,650 for an individual, and 138% of that amount, which is $21,597. Medicaid enrollees often don't pay anything when seeing Medicaid services because studies have shown charging even small co-payments prompts low-income people to forego needed care. In recent years, some states have added charges under $10 for certain services. The policy won't apply to people seeking primary care, mental health care, or substance abuse treatment. The bill allows states to enact even higher cost sharing for enrollees who seek emergency room care for non-emergencies. But if Medicaid patients fail to pay, hospitals and other providers could be left to foot the bill. So, cuts for lawfare present immigrants. Now listen to this. The GOP plan could cause at least hundreds of thousands of immigrants who are lawfully present, including asylum seekers, victims of trafficking, and refugees, to lose their ACA marketplace coverage by cutting off the subsidies that make premiums affordable. The restriction won't apply to green card holders because the immigrants who will lose subsidies under the legislation tend to be younger than the overall United States population. Their exit would leave an older, sicker, and costlier population of marketplace enrollees, further pushing up marketplace premiums, according to marketplace directors in California, Maryland, and Massachusetts, and health analysts. Check this out. It's time for people to take their own health into their own hands. Listen up, ladies and gentlemen. People got to start eating healthier, start working out, start exercising, drinking plenty of water. We don't necessarily need a pill for every little thing, because there's always an adverse effect to everything that people put into their bodies. You know, I practice what I talk about. I practice what I teach. I practice what I preach. I make sure I live clean. I make sure I work out consistently. Concluding this article, taking healthcare access away from immigrants living in the country legally, quote, will do irreparable harm to individuals. We have promised to protect and impose unnecessary cost on local systems already under strain, end quote. John Slocum, Executive Director of Refuge Council USA, an advocacy group, said in a statement, the bill reflects the Trump administration's restrictive approach to immigration because it ran afoul of Senate rules. The legislation doesn't include a proposal that would have reduced federal Medicaid payments to states such as California that use their own money to cover immigrants without legal status. So, this article was written by Julie Rovner. She is the KFF Health News Chief Washington Correspondent. I want to give her props for this article. I always make sure that I cite the source where I get my information from and give credit to the writer of the articles. Never surrender, never quit. Thank you for watching.